Dr. Brian Koffman, a family doctor, doctor turned patient, and you want to introduce yourself?
Andrew Schorr, journalist who continues journalism but became a patient.
So, Andrew, just kind of give us a very brief synopsis. You were diagnosed a long time ago, and just tell us you were...
Sure. I was getting nosebleeds while I was jogging, and my primary care doctor took a look up my nose to see if there's something to cauterize, just like a blood vessel. I'm sure you've done that. And there wasn't. And had a blood test, and it showed a higher white count. And when he said, "How do you feel?" I said, "I feel fine." He said, because your white count maybe meant you had an infection." I didn't. And that led to being diagnosed with CLL, and then a journey of 4.5 years watching that go up until I had FCR.
Right, which was an experimental therapy at that point.
Yeah, I was patient number 60 in the phase 2 clinical trial, and for me it worked. I mean, I had 6 months of therapy, so usually 3 days a week, 1 week a month. Had the nausea, had the fatigue, but kept working. And then everything worked out fine. About 6 months after that, my platelets went down to, for me, was a scary level, about 30,000, but then spontaneously reversed themselves, and I never had any other CLL treatment after that.
And how many years ago was that?
The treatment was in 2000.
Wow.
So we're talking about well over a decade. And when I tell people, you know, I talk about being in a clinical trial, which it was, phase 2 trial, I said, I got that therapy 10 years before it was approved, you know, by the FDA and then used in Europe. So I always encourage people to investigate trials. For me, I was in that 30% or so where it worked and continue to have the benefit from it.
Good. So talk to me a little bit about this, because you are a reporter and you do this. How did you choose to get into that FCR trial? What was your decision-making process so we can learn from that?
Well, you know, you wonder, why do things happen at a certain time period? And are you fortunate if things happen, in the case of medicine, when there are better medicines that are in trials or become available? And for me, it was even more than that. It was really the advent of the internet. In 1996, when I was diagnosed, there were patients starting to talk to patients in their own little communities and channels, and one of them was about CLL. And a neighbor of mine helped me find it, and I introduced myself, and they said, "Are you seeing a CLL specialist?" And I said, "What's that?" I said, "I'm going to a community oncologist." They said, "Well, does your doctor specialize in CLL?" "No." They said, "Well, let us tell you where there are some." And so that led me to, in my case, MD Anderson in Houston. Could have gone a few other places. And they said totally different things than what my doctor in Seattle, who was a generalist, was saying. And that led to ultimately the discussion, hey, we have a clinical trial we think might be right for you. I went back to the patient community. Anybody know about it? Several raised their hands, said, "I'm in it, I'm 3 months in it, I'm 6 months in it, I'm 2 months in it." I talked to them. So then when I went back to MD Anderson, they said, "Sign on the dotted line." I already knew I was, because I had this vanguard of patients who'd already walked ahead of me.
And there's 2 takeaway points from that. I think the first one is that there's a study now at a Mayo Clinic which shows that people who have a CLL expert as part of their team do better than people who don't do better. And the other thing, which has been shown in other kinds of cancers, any kind of support group is going to help you.
Absolutely. I mean, it helped my wife too. There's one other part of the story, you know, is that we wanted to have a 3rd child. I know you have 4. I had 2 at the time of diagnosis. We'd always wanted to have a 3rd child. When I was diagnosed leukemia, we thought I was dead, right? And my wife came with me to that first appointment at MD Anderson. They took 10 tubes of blood, the bone marrow biopsy. Now they're looking at the results. She said, "Would it be crazy for us to have a 3rd child?" And my doctor, Michael Keating, gives her a big hug and says, "Go have your baby." So we did. So I have a 15-year-old son, and I'm feeling good from the CLL, and that never would have happened, you know, the right treatment and the confidence to have a child, had I not gotten, I think, to knowledgeable doctors.
Now, you had another challenge that kind of hit you unexpectedly. Can you tell us about that?
Sure. So we're here at the American Society of Hematology meeting in December. Well, in December 2011, just prior to that, I was having some weird things go on, and among them were blood clots in my legs. And I was being monitored because I chose to be in a trial for better medicine for that. They were monitoring me very carefully, and they noticed that one part of the blood count, granulocytes, were higher for no explained reason. So they investigated further. Come to the ASH meeting last year, get a call from my doctor back in Seattle who'd run some blood tests, and he said, you have a genetic mutation called JAK2. What's that? He said, well, it probably means that you have an unrelated cancer, scarring in your bone marrow, myelofibrosis. Now, I'd never heard of it. Kind of like CLL, I'd never heard of that. And so that later led to a bone marrow biopsy that confirmed that, and then ultimately going on treatment just about 6 weeks ago with a new targeted therapy. And I'm happy to tell you, I feel great.
And that's a pill, this new?
It's a pill. I take one pill in the morning and one pill at night, little 10 milligrams. I mean, it looks like aspirin. And I have to tell you, this medicine, and thank goodness my insurance pays for it, is $7,000 a month. So a bottle of pills, I showed it to my daughter last night. I said, see this bottle looks like aspirin? That's $7 grand right there. But I had an enlarged spleen. I was getting night sweats. I was fatigued. I had itching that goes with this illness. For some people, it becomes unbearable. It hadn't gotten to that point for me. All that is gone. Now, the scarring in the bone marrow is likely still there. The medicine deals with the symptoms. Unfortunately, it doesn't deal with the underlying condition. This one doesn't. There are others in trials. So what does the future hold? I don't know. Today, I feel terrific.
So tell me, I mean, you've obviously navigated through this extremely well for yourself and for your family. So what can we learn? What tips? You know, you're a very web savvy from the beginning patient. You're also someone who's, you know, very much of a patient advocate and your own advocate. So tell us what other people can learn when dealing with a life-threatening cancer.
Okay. So the first thing is you have to get smart. If you don't feel confident about it, then your adult child, your teenager, whoever can say, they can say, what can I do for you? Say, help me research this, or help me understand some things I don't understand. That's part one. Part two is help me find the resources. They may be websites, they may be what you do, what I do, they may be advocacy groups, and the providers who are knowledgeable to become part of my team. So you want to pick the team that is in the strongest position to be knowledgeable to help you to understand your individual case. You don't want cookie cutter treatment. You don't want a pat on the head. And you want people to support you. So find where that support is. Today, there are many resources for that. And in the case of these conditions we've been talking about, CLL or myelofibrosis, these are more specialized conditions. And if you think about in oncology, the typical general oncologist deals with what? Lung cancer, colon cancer, prostate cancer, colon cancer, etc. Those are the biggies. Breast cancer, those are the biggies. You're somewhere down the line there.
Yeah.
You got to find somebody where you're at the top with them. That's what they live and breathe. So that's my best advice. And then have ongoing support community of other patients too. One other thing about that though, your CLL, as you know, was very different from mine. So if you said, oh, Andrew, you're going to need a transplant, that's not what I needed. So we have to be careful in sharing information among patients to assume that the other guy's story is exactly yours. We're finding the heterogeneity of it, if you will, and keep that in mind.
Last question. Psychologically, this thing must have hit you sideways.
Yes.
You think, I got the CLL, everything's been clean, I've been seeing the doctor, it's been social more than medical, the visit for 10 years now. How did you deal with that, and how did you get yourself back on the feet to sort of make the kinds of decisions?
Well, it goes back to the CLL. You know, my wife and I experienced how the timing of my CLL and the response I got to a clinical trial was terrific. Doesn't always happen to everybody, and it might not have happened to me, but it did. So I got my fingers crossed that I'm on that train again, that I'm at a time when medicine is changing. I already have one medicine that's been working very well on the symptoms, and that I will be lucky enough that this will just be chronic, and I'll get to do what I love to do, and maybe not, But you know, I could worry about it, or I could just say, hopefully the timing's right today, I feel good, and I'm going to go do what I have to do.
Thanks so much. It's great to see you, and we'll keep up this conversation.
Thank you very much.
All right, for years.
Thank you.
Thanks.